Get answers to your questions about back pain. Call the physicians on our phone bank now at 478-752-1300. Tonight's phone bank sponsored by Neuroservices Navicent Health.
Hi, and welcome back to our live broadcast where we're talking about back pain today. And with us today is Dr. Hugh Smisson, and he is a neurosurgeon with us. And thank you so much for joining us today.
You're welcome. Thank you for having us.
Well, we've heard a lot today about back pain and kind of the treatments, but tell me a little bit about the new technology you guys are using called Mazor.
Okay, so the Mazor system, and just as a start, the medical centers has really been great over the years. They're always coming out with the best new technology. They partner with the doctors extremely well. But one of the systems that they came up with and was presented to us about a year and a half ago was the Mazor system. And what this is it is a new technology to make the placement of rods and screws or screws into the bone much more scientific. We've been putting in pedicle screws for going on 30 years.
Oh, wow.
As a treatment for stabilization of the spine. Before that, in my father's day, when he was treating, they actually would put people in braces for 2 months at a time after surgery for their bone to fuse. The pedicle screws allow us to stabilize the spine so that it gets everything so you can get people up moving. The Mazor system has allowed us to do this in a more scientific way by being really connected to a computer that helps us put these in more accurately.
So more accurate and better outcomes.
Better outcomes, yes, with shorter surgeries and much less muscular dissection.
Wonderful. Well, give us a call with your questions. You give us a call at 752-1300.
Tonight's phone bank sponsored by Neuroservices Navicent Health. Get answers to your questions about back pain. Call the physicians on our phone bank now at 478-752-1300. Tonight's phone bank sponsored by Neuroservices Navicent Health.
Hi, and welcome back to our live broadcast where we're talking today about degenerative back disease. And with us today, we have Dr. Hugh Smisson. Thanks for joining us.
Thank you for having me.
Now, we've been talking a lot today about surgery, non-invasive surgeries, but what we haven't touched is a little bit about laser surgery. Tell me a little bit about what that is.
Okay, so laser surgery is really sort of a misnomer, okay? A laser, most of us feel like a laser is really sort of an expensive knife.
Gotcha.
Okay, so the fact of the matter is you see the advertisements for the laser surgery. Most neurosurgery suites have a laser. We use it for brain surgery. We use it for different things. Even that has actually fallen off the wayside as more modern technologies have come on. I think we got our first laser in the medical center maybe 25 or 30 years ago.
Oh, wow.
It's sitting on a back hall getting with cobwebs on it.
So is it the best treatment for your patients?
There's the very rare patient that might benefit from it, but almost none that benefits from it over a traditional microsurgery. So the thing about it is the surgeries that most of us perform, if we're minimally invasive, are really equivalent to a laser surgery without the advertising gimmick.
Gotcha. Well, thank you for explaining that to us.
You're welcome.
And we'd love for you to give us a call at 752-1300 with your questions.
Tonight's phone bank sponsored by Neuroservices Navicent Health.